You have been waking up stiff, your back aches after sitting for an hour, and you keep telling yourself this is just what getting older feels like. But that's not true. Your back is not hurting because you're 40. It's hurting because of what has been quietly happening to your spine and nobody has explained it to you yet. Hi, I'm Dr. Jayesh, a spine surgeon, and the most common thing I hear from patients in their 50s and 60s is I wish someone had told me this 10 years ago. So consider this your 10 years early warning. By the end of this video, you will understand exactly why back pain gets worse after 40. The everyday habits that silently speeding that process up, and 4 simple things you can start doing this week to stop it. And it tracks without medication, without surgery, and without giving up the life you enjoy. In your 20s and 30s, it absorbs everything. Long hours at desk, bad posture, skipping the gym, it handles it quietly. You barely notice all this. After 40, that thing changes. The soft cushions between your spinal bones, your disc, they start losing water content. They become slightly thinner and less flexible, like a sponge that has been started to dry out. They cannot absorb shock the way they used to. At the same time, the small joints in your spine start showing early wear and tear, and the muscles that support your spine, if you have not been actively using them, have weakened over the years. So now your spine is doing the same job it has always done, carrying your weight, absorbing every step, supporting every movement, but with less cushioning, less joint flexibility, and less muscular support than it had before. That is why the same desk job that felt fine at 32 is giving you back pain at 42. Your spine's ability to cope has quietly reduced while your daily demands on it have stayed exactly the same. Here's the part most patients find surprising. The pain is not coming from one big moment. It's coming from smaller daily habits repeated thousands of times. Sitting for too long, looking down at your phone for hours, weak core muscles, and when those muscles are weak, your spine absorbs all that load by itself. Every step, every hour you sit, every time you bend, your disc and joints take the full hit instead of your muscles that should ideally share it. That morning stiffness, that ache after a long day, most people take a painkiller and carry on. But those small signals are your spine telling you something needs attention before it becomes something that cannot be ignored. Now, it is never too late, and you do not need to overhaul your entire life. These 4 habits done consistently will make a significant difference. So number 1, break up your sitting. Every 45 minutes, stand up, walk to the kitchen, stretch for 60 seconds. That simple break releases the pressure building up on your disc and keeps blood flowing to your spine. Second, build your core. Not six-pack abs, but the deep core muscles. A simple 10-minute routine 3 times a week. Something like planks, bridges, gentle back extensions. Build the muscular support like a belt your spine desperately needs after 40. Third, raise your phone. So instead of looking down at it on your screen, bring it up to the eye level. And lastly, stop ignoring your back pain. If your back has been aching for more than 4 weeks, get it assessed. A small problem addressed at 40 is usually just a simple physiotherapy. So here's the truth. Your back is not hurting because you're 40. It is hurting because your spine has been quietly changing, and the habits you built in your 30s are no longer enough to support it. And if your back pain has been going on for more than a month, please do not keep waiting. Book an appointment with a spine specialist this week. Come in before it becomes the kind of problem that takes months to fix instead of weeks. Share this with someone in their 40s who keeps saying that back pain is just a part of getting older. What they do in the next few months would determine how their spine feels for the next 20 years.